So I am asking that you all join me in my imaginary porch. I'm from New Orleans, and I just remember, even though the home I grew up in, we didn't have a porch, but I already knew porch talks are the place where learning takes place and where you feel safe enough to ask questions, but also share information. And what I would like to do is to share some information with you. Today, what I want to do, and I'm going to share my screen here. I want to, there we go. Today, I want to name something that many helping professionals experience, but they rarely say it out loud. And it may be true for all of us that are in the room. So, a question I have is, have you ever been so emotionally tired that even rest doesn't feel like rest anymore? And you're welcome to join in the chat with your response that if you've experienced that, or if you've heard someone say, don't overthink this. And just like clockwork, you begin overthinking whatever it is. If those two things landed for you, it tells us something important. It tells us that it tells us that it's not just about being tired or needing to more sleep. There is this type of exhaustion where the body may slow down, but the mind just keeps working. And that is where we are starting today with talking about quieting the overthinking mind. All right. Give me just one second. There we go. So if any of that feels familiar, just know that you're not alone. Many helping professionals are carrying layers and layers of stress that never fully shut off, even during moments that are supposed to be restful. And one of the biggest contributors to that exhaustion is something that you really can't always see it, but you can almost always feel it. And that's that overthinking. Not a thoughtful reflection, not an intentional planning that we put in place. I'm talking about the quiet mental loops, the small what ifs or I should have that starts as a whisper and then it slowly starts to grow louder and louder. The kind that follows you into your rest and your relaxation. And it keeps the body kind of tense when nothing is really happening. And it leaves you feeling exhausted without fully understanding why. Why is that happening? So before we go further, I want to share why this conversation matters to me. For over 30 years, I have worked as a college professor, a mental health professional, and a consultant alongside other helping professionals, especially women who care so deeply and they carry a lot. And what I have seen again and again is this, that give me one second here. What they are doing is they are carrying that with them over and over again. And what it does to them is it causes them to be there for others, but not there for themselves. So this conversation really matters to me because of this. And so going to the next slide, I've had 30 years of working as a professor and as a mental health professional and seeing all this taking place. And what I decided I needed was clarity. And this is for myself, where I needed clarity, calm, and real peace. And so that's what I needed for myself. And I realized that and realized I need to give that to others. So what I've seen this again. And people can be giving their best at work and at home and in their communities and still feel mentally overwhelmed in ways they cannot explain. And so, again, I know this experience personally. This presentation actually is sponsored by one of the patterns that I'll be talking about around overthinking a little later. I have lived through these seasons where my body was just tired, but my mind would not rest, where slowing down didn't bring relief. And I started to wonder, why rest no longer felt restorative, and what was happening inside that made everything feel so heavy. I came to believe that I deserve clarity, calm, and that real peace. And so do so many women. And it's that belief that has led me to this work. And that's why I'm here today to help you to understand what is happening inside and to offer at least one simple way to reduce the pressure in our mind that we've been carrying. So this is how overthinking shows up in everyday moments. Your head hits the pillow, the world finally starts to get quiet, and suddenly your mind gets loud. You begin to replay conversations from 8 hours ago, or you pre-play a meeting that is still days away. And you begin to analyze a simple decision that you have to make until the moment has already passed by you. And this is not, the individual being dramatic. It's definitely not a lack of self-control. What's happening is that our mind is staying alert. It believes that if it reviews enough, if it prepares enough, or if it analyzes enough, it can keep us safe. But here's the part most people are not told. Thinking harder does not make you safer, it makes you exhausted. So let me say that again. Thinking harder does not make you safer, it makes you exhausted. Your mind is trying to protect you, but the strategy is actually working against you. And so the alarm just stays on even when there's no danger actually there. So what happens over time is that the mind and body can start reacting to stress as if everything is an emergency. And a critical comment or a mistake that you make or a disagreement can feel just as alarming as real danger, even when you know you're not actually at risk. And this is happening not because we're weak, and it's happening because our system has learned to stay ready. All right. So just remember that overthinking is trying to protect us. And so what I want you to understand is that overthinking is not random and it's not a flaw. It is one of the ways your body and your mind is trying its best to protect you from any harm that may come your way in the future. All right. So what I want you to understand is that since it's not something that is random and it's not a flaw, that it means that it's something there that's trying to protect you. So we all have this internal alarm system that's designed to keep us safe. And when it senses that there's possible risk, it stays alert by reviewing things, by analyzing and trying to prepare you to be able to get into that attack mode so that you can stop the harm from coming and attacking you. The challenge is that the system doesn't do a good job of distinguishing between actual danger and perceived threat. So the alarm stays on, not because something is wrong with you, but because the system is trying to help. So let me give you an example. Imagine you're taking a driving test to renew your license. And so some of you probably have to do that soon, and you're probably thinking about it. You have been driving for years and you know the rules of the road. But the moment the test begins, your mind starts scanning for mistakes, and you begin to second guess your answers that you already know, and your body may start to tense up. And that's not because you all of a sudden forgot how to drive. It's because the alarm is on. So when the alarm stays on, it tends to show up in a few predictable ways, and not as labels, and not as diagnosis. Sorry, let me go back to this one. Not as labels and not as a diagnosis, just as a pattern. And many of us recognize, and we recognize those parent patterns once we have a name for them. So what I want to do is I want to walk you through three common patterns, which are the ways that our protective system is set up. And it shows up when overthinking takes over. And before we name them, I want to just stop for a moment here, and I want to be clear about this. Overthinking is not a sign that something is wrong with you. It is a sign that something is happening inside a system that learned to stay alert. So I want us to just take a moment, and even though I need to take a deep breath, sometimes this information comes and it's so big and it can bring up emotions that I want to make sure that we're taking care of ourselves also. So if you can just take a deep breath with me, and I'm going to imagine that I feel it, okay? Okay. Do you hear the silence? So as you now listen, there is nothing for you to figure out or to fix. Just notice what sounds familiar. All right. So let's start with the first one. And we're going to call this pattern the time traveler. So most people recognize this time traveler. It's the one that pulls your mind backwards in time, and it starts to replay what already has happened in an attempt to protect you from what might happen soon and or in the future. So this is the way the mind tries to protect you by reviewing the past over and over and believing it can go back in time to change the outcome. I always think of Back to the Future with this one. And so what happens is it replays the conversation, it rewrites the moments. It wonders, why did I say that? And it examines old situations as if the right analysis could erase the regret that you might be feeling about the past. But we all know we can't go back in time to change what has already occurred. And this is what I call the time traveler. The time traveler, by the way, is a procrastinator. You know, you find procrastination living with the time traveler. And the primary question that the time traveler will ask is now the right time? Or so what it's trying to do is that it's replaying the past and it's jumping to the future, and it gets stuck in the shoulda, coulda, woulda. I want to write a song about that shoulda, coulda, woulda, or the what ifs. And what it does is that it delays the actions while trying to feel more certain about the decisions that are being made or was made in the past. The time traveler keeps leaving the present and going back into the past because taking actions just feels unsafe because the mind is still time hopping. And the time traveler is convinced that if it studies yesterday long enough, it can prevent pain of today. But what it actually creates is emotional exhaustion, and self-criticism is what it creates. Woo! So that's our time traveler. So I just need to take a little breath here because the time traveler could just make you so tired, and just talking about it makes you go, whoa, I need to take a deep breath. All right. Well, the next one is the fortune teller, and the fortune teller can make you feel the exact same way, but not as intense as we know that the time traveler can. But the fortune teller has a habit of scanning the future for danger and imagining the worst case scenario as a way to keep us safe. And so the fortune teller will say, well, what if I fail? What if they judge me? What if something goes wrong? And so the fortune teller believes that fear equals preparation. And so it does a lot of people pleasing. But imagining painful outcomes makes you live through stress that has not even happened and may not happen. And it's not intuition, definitely is not. All it is anxiety rehearsing possible danger. And some of the primary questions that the fortune teller will ask is, how will this affect someone else? And the patterns that you end up seeing from it is that it's constantly scanning for reactions and looking for the disappointment or conflict from others. And it begins to worry about everyone else's needs and their expectations. So it will attempt to adjust its behavior to prevent discomfort. And a lot of times that discomfort, they're trying to not feel this discomfort that they may see coming from others. And so the fortune teller is focused outward, and overthinking is used to keep relationships and roles stable. All right. Whew. Take another deep breath for me and with me before we move into our last one, our last overthinking pattern. And so that's the chess master. And this is the pattern where you find overanalyzing every option as if the perfect choice will guarantee safety. The chess master wants more data, it wants more information, and it wants more opinions from everyone else. And it believes that choosing the wrong thing could create harm. So the chess master will delay, it'll freeze, it will postpone completing things because it's looking for perfection. And so you stay stuck at this crossroad, drained from thinking, but unable to act on things. So the primary question that the chess master may ask is, did I do it right? And the pattern you begin to see is where it tries to think through every possible move so it can manage the outcomes, and it does this decision making all mentally, and it's struggling to maintain whole. And so the chess master believes safety comes from getting it exactly right. And so overthinking becomes its preparation. All right, I have to take another deep breath on that. So those are our three patterns. But I want you to remember that they are actually there to protect you. But remember, they can't determine whether or not you need that protection, because it can't determine whether or not the protection is needed to stop it or to just run away or whatever it is that you need to do to take care of yourself. So here's the insight I want you to take with you. The time traveler pulls you into regret and procrastination. The fortune teller pulls you into fear and people pleasing. And the chess master freezes your ability to move forward because it's looking for perfectionism. But here we have different patterns, because we just talked about three different patterns, but we end up having the same outcome, which is exhaustion and anxiety. But now that we have the awareness, this is where possibilities begin. Awareness creates options. I'm going to say that again. Awareness creates options. So when these patterns stay unseen, they can create this stressful loop. And I sometimes call that stressful loop the hamster wheel, where the mind keeps spinning and the body stays tense and rest becomes impossible. So to step out of overthinking, that overthinking loop or the hamster wheel, your mind and body definitely do not need more analysis. Your mind and body in that exact moment needs a signal of safety. And I want to share at least one way to offer that signal. And it is small, and it's small on purpose, because when the system is activated, simple is what works. Let us try this together. So I'm going to help give you this simple thing, but it's a powerful thing. And I'm just going to take my hand and I'm going to place it on my chest. And all I'm going to do is what we've been doing so far, which is taking that deep breath, which is to take that gentle inhale and to slowly exhale just a little longer than that inhale, and quietly tell our body, I am safe right now. And literally, that's it. That's the shift. This is not about stopping overthinking forever because that's not a thing. You can't stop it, but you can turn down the volume so that you can create space and clarity, and planning your next step can begin. So that simple step was the transition. And that's one of the things that a lot of the times, we try to jump over that small little piece of space that helps us to create the clarity and allows us to move into an area of choice. And that is to take that deep breath, because now what can happen is more advanced techniques can come in. And there's something important I want to name here. Many of us move so quickly to reflection, to insight, to change because we want that relief. But when the body is still holding tension, those tools can feel hard to access or simply do not work the way we expect them to. This is not because you are doing self-care wrong. It's because the body needs to feel safe before it can support clarity, choice, or deeper care that is needed. That small signal of safety you just practiced is often the step we try to move past. But because it is, and it's not because it's not important, but because it feels too simple. And yet it often is the doorway that allows everything else to take place. So overthinking is like quicksand. The more you struggle inside it, the deeper you sink. And overthinking thrives on that struggle. So what we do is to design an individualized system that works for you and only you. For example, so I'm going to use Anne, not a real person, but I'm going to use Anne. And it may be to start, Anne may start with focusing on awareness. The moment Anne notices her mind replaying the same scenario over and over, and her mind is saying, you should have, you could have. Within 5 seconds, what Anne does is she recognizes the sign that it may be saying, that this loop may be saying to her. And what she'll do is she says, oh, this is the loop. I don't have to follow it. That's her awareness system being activated. And it is a choice that she has made and she's practiced over and over, because overthinking has had years of functioning, and she's made a conscious choice to give herself an awareness system and give it time to begin doing what it needs to do. And from there, Anne may focus on setting mental boundaries and giving herself permission to think about the problem, but within limits. So what Anne does is sets herself up with some type of a timer, and this is a little hourglass. And she gives herself about 10 to 15 minutes or 5 minutes, but she makes that determination how long that she's going to brainstorm her solutions. And if she's not finding new solutions because she's on that hamster wheel, and the hamster wheel doesn't allow for new things to come in because it's going so fast. And because when you're stuck on that hamster wheel, there's not enough time to think of solutions. Another thing is overthinking just thrives on perfectionism. And real progress comes from imperfect action. Anne may recognize when she's looking for perfection or the perfect choice, and she begins to interrupt that with, what's my next step that I can take right now? Literally saying it out loud, because sometimes you have to hear yourself thinking out loud. And by saying that out loud or to herself intentionally, she's making another shift. And this last example is decluttering the mind. So one of the things I do to declutter my mind is I journal. And if I'm not journal, if I'm driving and I have my phone, I may, or if I'm in my car or somewhere where I don't have a pen and paper, I am able to take that out and I can begin dumping all my thoughts that are going on in my mind in that moment. And so those are just 4 examples of actions that could be taken to quiet her overthinking mind. There is a chance if Anne would have taken the generic route of taking a bubble bath or going to the spa, she'd still be on that hamster wheel of overthinking instead of creating solutions. What I want you to remember is this: overthinking is not something you need to fix or get rid of. We put too much attention on that. It is something that we want to learn how to have the tools to control it. It is a response that can be understood and gently guided. That small signal of safety you practiced earlier of breathing is one way to support your mind and body when that loop shows up, and a way to create clarity and more supportive actions. And the awareness you built today is already part of that shift. So, what I have for you here is 10 things to notice before stress becomes your normal. Because even though I talked about overthinking today, overthinking is not alone when it comes to what's causing us stress or causes us burnout. And I'm going to do like Thais because there is something for you. After you finish the 10 things you notice before stress becomes your norm, there's a little surprise for you right after that. So I'm hoping that you pick up this freebie, the 10 things to notice, and begin building your awareness. And if you find yourself replaying conversations and running through decisions again and again, or thinking about what you should have done differently, you are not alone and you're not doing anything wrong. Just remember, many of us do this. So thank you so much for allowing me to be here and to have this conversation. And thank you all for joining me on the porch for this conversation. Thank you.